Namaste, ladies and gentlemen. It is indeed a proud privilege to be here amongst knowledgeable Vaidyas and teachers who have taken upon themselves to propagate the wisdom of Ayurveda to students and doctors in the United Kingdom. I also thank the organizers of the conference and Dr. Sureshji in particular in giving me this opportunity to present my thoughts on Panchabhautik Chikitsa and Hrudroga. Before I move ahead on my specific talk, I'd like to make a small acknowledgement. Now, this talk is based on the original works of our revered Guru, Bruhattrayi Ratna, Vaidyaraj, Atmaram, Datar, Shastri, who was confirmed this title for his pioneering work in Panchabhautik Chikitsa. This talk is based on his book in Marathi titled Ayurvedantargat Hrudrog, originally published in 1968. A summary of which was written by Vaidya Ashok Wali, the present chairman of Vaidyaraj, Datar, Panchabhautik Chikitsa and Anusandhan, Kendra, Sangli, Maharashtra. I shall cover my talks in the following parts. A brief on nature, human body gunas, environment and constitution, development of the heart, significance and importance of the heart, guna considerations, causative factors of Hrudroga, samprapti of Hrudroga, udara parikshan, abdominal examination, types of Hrudroga and treatment and Chikitsa options. Coming on to, as humans, we are integral to nature around us. What exists in nature exists in the human body. Both the environment and the human body are Panchabhautik in nature and have different percentages and combinations of the 5 great elements, which is Pancha. Similarly, the food and nourishment that the nature provides us is also Panchabhautik. So essentially, the Panchabhautik ahara is digested by the Panchabhautik agni to nourish the Panchabhautik sharira. Now we can have a look at the Panchabhutas from the perspective of their gunas. So Akasha has Mrudu, Laghu, Sukshma and Slakshna gunas. I can give you the English translation if you want to, but in terms of time, I'll just go ahead. Vayu has Shita, Ruksha, Khara and Vishada gunas. Teja has Ushna and Tikshna gunas. Apa has Drava, Snigdha, Manda, Pichila and Sara gunas. Prithvi has Guru, Kathina, Sthira, Sandra and Sthula gunas. Now we can generally classify these two groups, the Pancha Mahabhutas, into 2 groups based on their guna sadharmya. So what is visible and what is invisible. So we can group Prithvi and Apa on one side and Vayu and Akash on the other. But Teja Mahabhuta is independent energy and Shakti. Now, as this energy oscillates between the 2 groups, we find major events in the environment and transformations that happen in the body. Coming on to the environment and constitution. The environment around us changes constantly based on the time of the year. Any change in the Kal has a profound impact on the environment and therefore the human body. A calendar year can be divided into 2 ayanas, Uttarayana and Dakshinayana, based on the alignment of the sun. When the sun moves to the northern hemisphere and to the southern hemisphere. Each of these ayanas are of 2 months each. Each ayana can be further divided into rutus, 3 rutus of 2 months each. Of these, you will find Hemant and Shishira, which fall in the winter months, have the highest bala. The Sharad and Vasanta rutus are of medium strength, while the Grishma and Varsha are of lower strength. Now, therefore, you find that the rutus have an impact on the strength of the fetus at the time of conception. So, as well as the strength of the fetal heart, which develops in the 4th month of pregnancy. Therefore, the time of conception, the state of nature, when the fetal heart was created, will influence the inherent deha and hrudaya prakriti of the child. Once this is clear, the understanding of the patient's heart disease and his treatments becomes that much easier. Development of the heart. Conception is the result of union and Shukra Artava. Shukra is Saumya, gentle and mild, and therefore has more of Prithvi and Apa Mahabhutas, while Artava is Agneya, pertaining to Agni, which has more of Teja Mahabhuta. So one has a Shita guna while the other has a Ushna guna, which implies that the union of Shita and Ushna guna results in conception of the fetus. Now, the fetus grows stage by stage in the uterus, and the fetal heart develops in the 4th month of pregnancy as per Ayurveda, and it grows from the fetal blood and kapha. That is why the origin of heart says Shonita kapha prasadajam rudayam. During this period, the pregnant woman craves for specific foods that are useful for the development of the heart. If her desires are fulfilled, the fetal heart grows well. Otherwise, there is a likelihood of shortfalls. Ayurvedic texts advise both vegetarian and non-vegetarian diet for nourishment of fetus and the fetal heart. Milk and fresh butter, which is navneet, are pranada, having qualities of prana or life force. They are madhura of madhura rasa, pichila, shita, snigdha, and slakshna and saragunas, which strengthen the kapha dhatu. At the same time, navneet is kashaya, astringent, and is alpa amla, which provide the nourishment to the heart. Kashaya rasa, astringent taste, corresponds to Vayu and Prithvi Mahabhuta, now which provides the strength and durability to the fetal heart muscles. The alpa amla rasa increases the strength of the Agni and nourishes the Rudya and Medya bhavas along with nourishing the Rakta dhatu. As per the Samanya Vishesh Siddhanta, Mausa rasa nourishes the Mausa dhatu of the fetal heart, making it stronger. Jangala Mausa, which is rasa of Kashaya rasa and Madhura, it has affinity to the heart, it is Laghu, and it has a special quality of Basti Shodhana. The primary function of the heart is to supply and rasa and Rakta dhatu to the whole body. Therefore, after the formation of the heart in the 4th month of pregnancy, the heart works continuously, uninterrupted until the death of the body. This implies that the heart's creation should be just as strong. From the Panchabhautik viewpoint, the heart is mainly a combination of Tej, Prithvi, and Apa Mahabhutas, although Akasha and Vayu also have a role in its creation and function. Let's look at the Ayurvedic perspective of Hridaya. So, from the Ayurvedic perspective, Rasadhatva di Marganam Sattva Buddhi Dhyatmanam Pradhana Sojas Chaiva Hridaya Samsthanam Uchyate Hridayam Chetana Sthana Muktam Purusha Dehinam. The heart is one of the main 3 marmas. It is through the heart that the Sapta Dhatus are nourished and they receive the strength to carry out their respective functions. Additionally, the heart is the seat of Sattva, Buddhi, Indriyas, and Atman. Our consciousness is seated in the heart. Even our Upanishads say that our heart is the seat of Paramatman. In our literature, heart is considered the seat of the mind. For example, the expressions of heartfelt, heart-wrenching, etc. are used in all literature. Therefore, any activity or disturbance in the mind has an impact on our heart rates. Emotions such as fear and surprise excite or increase our heart rate. On the other hand, if we are calmly sitting or sleeping, the heart becomes normal. As the heart is a soft organ, it is considered as coming from the Matruja Bhava, from mother. Coming on to the Guna considerations, now let us consider the property of the 5 great elements in terms of 2 main constitutions, Sthula and Ruksha. Our bodies experience these constitution states over our lifetime. Now, Sthula is the quality of Prithvi Mahabhuta and its accumulation and its associated gunas of Guru and Ruksha. Accumulation of Prithvi Mahabhuta or Parthiva elements in the heart occurs due to the inability of the Parthiva Agni, one of the 5 Bhuta Agnis, to digest the Parthiva elements. Additionally, there is an associated increase of Medas. Together, they reduce the Akasha and space element in the heart, and the atria becomes constricted by this fatty growth, obstructing the movement of Vayu. On the other hand, the Ruksha Guna does the opposite, whereby the movement of Vayu and its flow is unrestricted. When considering the heart disease from the Panchabhautik perspective, the 2 gunas of Sthula and Ruksha are important to consider. So generally, heart disease has 3 main symptoms at a high level. Heaviness in the heart, it's a symptom related to the Guru Guna, which belongs to the Prithvi Mahabhuta. Due to weakness of the Parthiva Agni, there is an accumulation of undigested Parthiva elements, which increase the Guru Guna, causing heaviness. Daha or inflammation, it's a symptom of increase of Teja Mahabhuta. And palpitations in the chest, this is a symptom of increase of Akasha and Vayu Mahabhuta. Now let's coming on to the causative factors, causative factors of Hrudroga. The shloka explains the causative factors very well, and I will just translate them into English. So what it means is suppression of natural urges, excessive consumption of dry, heavy, hot, pungent foods, consumption of incompatible foods, chronic indigestion, overeating, eating foods which are asatmya to your body and the constitution, excess consumption of astringent and bitter taste, excessive labor and work and traumas, etc., and constant worries and anxiety result in the following types of heart disease. So each of these heart disease, so here you will find you have Vata Prakopa heart disease because of suppression of natural urges, dry fruits, excessive labor and trauma, Vata Prakopa. Kashaya and Tikta will increase Vata. Worry and anxiety will trigger Vata. Asatmya foods based on the Prakopaka Ahara. Chronic indigestion based on the Prakopaka Ahara. Heavy to digest foods will generally result in Kapha Prakopa. If one analyzes the above hetus, the causative factors, we will realize that the gati of vata is impacted from the beginning to the end due to avrodha, blockage, or disturbance. Now, when this avrodha spreads across the whole body, starting from the sense organs to the excretory organs, one can assume that the foundations of Hrudroga have been established in the patient. In a sense, akasha or space of the aparna kaksha gets filled up. It impacts the akasha space in the rest of the body. What I mean to say is, in a sense, when the akasha space in the aparna kaksha space gets filled up, it impacts the akasha space in the rest of the body. Now let's look at the samprapti or pathogenesis of Hrudroga. So the Samhitas talk about dushitvam rasam dosha viguna hrudayam gata rudi bada prakurvanti rudrogam cha prachakshate. What it means is, when the aggravated doshas vitiate the rasadhatu and localize sthana samshaya in the heart and interfere with the function of the heart, this is called heart disease or Hrudroga in Ayurveda. Now, if you look at the figure on the left-hand side of the slide, the portion of the body below the navel in blue is predominantly of Jala Mahabhuta. Now, this is the source or place from where the heart disease originates. All the waste from the rasa and rakta dhatus are excreted from the body through the urinary system. Similarly, the solid waste of feces is extracted from the body via the back passage. However, due to the above hetus and causative factors which we just discussed in the previous slide, the avakasha of the akasha of the aparna kaksha gets filled up. Now, when this happens, the jala mahabhuta in the aparna kaksha starts reducing and thereby increasing the ruksha guna or dryness. Now, as the dryness increases, it increases the guru guna, resulting in heaviness in the area. Now, due to the avrodha or blockade, the aparna vayu starts moving in the opposite direction, gets a pratiloma gati, and vitiates the samana vayu, which impacts the intake of food and nutrition. Now, the vitiation of samana vayu along with aparna vayu attacks the vyana vayu. This vitiation of vata due to the intake of foods with katu, pungent, bitter, kashaya, astringent rasas or taste, suppression of natural excretory functions, etc., and causative factors, there is an increase in gunas related to vayu mahabhuta. These gunas start depleting the gunas associated with kapha dosha from the sense organs, right from the sense organs to the guda pradesha. Even the annarasa, essence of food or child, predominantly contains more gunas of vata. Now, this vata predominant rasa and rakta, when transported all over the body by vyana vayu through the heart, the symptoms of heart disease, which are predominantly due to vata. In heart diseases where the causative factors are pitta provoking, ahara and vihara, diet and lifestyle, the heat and ushna guna combines with the unrestrained speed of vyana vayu and presents symptoms such as losing balance on walking, inability to turn around or look back quickly, which are more pronounced during midday. During the increase of Ushna Guna of Pitta, the gunas of Jala Mahabhuta, such as coolness and fluidity, are depleted, which present the symptoms of suffocation. Now, in kapha-provoking hetus, the movement of Vayu gets arrested, causing heaviness in the heart, resulting in symptoms of shortness of breath on minimal exertion and intolerance due to exercise. Now, we understand the heart diseases from the perspective of Gati of Vayu. As Pitta and Kapha do not have their own energies of movement, among the 5 sub-doshas, only Aparna Vayu is responsible for the disease manifestation. So, if the expulsion of malas, food and liquid waste from the body is not regulated and efficient, the body tends to accumulate the malas. The inherent qualities of Akasha Mahabhuta in the Pakwashaya, or the large intestines, are what? Mrudu. They are Mrudu, Laghu, Sukshma and Slakshna. The Vayu that circulates in the Pakwashaya is Shita, Khara and Ruksha gunas. and is supported by Agni having Ushna and Tikshna gunas. As the accumulation of malas in the Pakwasha increases, the functions of Agni or Vayu are disturbed. Therefore, the snayus or muscles of the intestines are distended or stretched. They lose the elasticity and stability, and resulting in increase of vitiated heat. The sequence of pathogenesis results in vitiation of Apana Samana Vyana Vayu, resulting in obstructive heart disease. Next is the Sahasaja Hrudroga. Now, due to Sahas, that is adventure, and Ati Yoga, which is excessive exercise, the whole body is affected. It particularly affects the Mausa Dhatu, muscle tissue, reducing its Lepana quality, resulting in Mausa Dhatu Kshaya. The Dhatu Kshaya results in increase of Vata Gati, resulting in Hrudroga. Now, let's look at the Udara Parikshan. Now, when we do the Udara Parikshan, abdomen examination on such patients, we will notice that the area around the navel becomes extremely painful on palpation. When the Apana Kaksha gets filled up, Apana Vayu flows in the opposite direction, Pratiloma Gati, vitiating the Samana Vayu, disturbing a digestive system, further vitiating the Agnis close to the Samana Vayu. Thus, now this vitiation of Agni near the Samana Vayu impacts the secretion of digestive enzyme, which is Tyakta Dravatuba from the liver, which further results in reduction and lack of production of Ahara Rasa. The resultant increase of saturation of Pitta in the liver increases the heaviness and density in the liver, making the situation even more complex. You will now hear Ghananada, dense sound on the liver during percussion. As the Rasa and Rakta Dhatu circulates all over the body through the heart, the vitiated Rasa Dhatu increases the Agni gunas of the blood. This impacts the spleen, which is Mulasthana of Rakta Dhatu. As a result, you will observe extreme pain on palpation of the spleen. Likewise, continuing palpation and percussion of the bladder, liver and spleen, you will notice various vitiated nodes by which one can draw conclusions during the Udara Parikshan abdominal examination. Now, the types of Hrudroga. As you see, we can, while Ayurvedic texts describe 5 types of Hrudroga, in practice we several of them, right from Sharirika types and Manasika types. In Sharirika, you have Doshaja, which is Vata Pitta Kapha, Sannipatika, Krimeja, Ekantika, Amla Sevanajanya, Avarodhajanya, Shukrakshayajanya, Sahasaja. In Manasika, you have Shokaja, Dukkaja, Buddhija, Chintija. I'll go through a couple of seconds on each of this. In Doshaja Hrudroga, if you consider each doshas, different types of colics and pains will indicate Vataja Hrudroga. In Pittaja Hrudroga, one emphasizes symptoms of excessive thirst, anger, fever, sweating, hallucination, and fainting. In Kaphaja Hrudroga, symptoms of heaviness, lack of desire of food, Agnimandya, nausea, excessive salivation, and so on. In Sannipatika, you will have a combination of these. And Krimeja Hrudroga, the origin of Krimeja is the Pakwasha. The heart disease due to Krimeja is called Krimeja Hrudroga. Eating during indigestion, consumption of sweet, sour, liquids, and food made from pishta, anna, jaggery, sleeping in daytime, lack of exercise, etc., results in germination of Krimis. Krimis are akin to worms and bacteria that originate in stagnant water in external world. Similarly, kleda and humidity to the body provides fertile ground for germination and relocation of the Krimis. Additionally, decay and decomposition of food in the intestine results in germination of Krimis. In Krimeja Hrudroga, dysentery, diarrhea, and lack of desire of food are common symptoms. Now, excessive consumption of sour foods. Now, due to excessive consumption of sour food, there is an increase in Vriddhi or Pitta Rakta. Solitary use of Andarasa does not augur well for the body and is contraindicated. Amla Pitta, alcohol, smoking, consumption of Vidaya Ahara, tobacco, vitiates the Rasa Dhatu, making it Agni in quality or fiery in quality, which then travels to the heart and creating heart disease. Avarodhajanya Hrudroga, there is a suppression of natural urges, excessive consumption of astringent, bitter, pungent, and dry foods, which results in vitiation of Apana Vayu, resulting in symptoms of pain in the bladder, pain in the heart, pain in the flanks and abdomen. Additionally, due to trapped wind, you will see symptoms of distension, bloating, excessive gas. Most part of the food also remains undigested, causing difficulty in expulsion, and therefore the Apana Samana Vayus get vitiated, resulting in Avarodhajanya Hrudroga. In Shukrakshayajanya Hrudroga, Shukra Dhatu is 7th Dhatu and is the essence or Sara of all the Dhatus together. A combination of excessive physical labor in the daytime with Ati Vyavaya or excessive sex at night can debilitate the body and present signs of limpness, lowering of ojas, and loss of Dhatu Sarata. The patient loses energy and enthusiasm, has reduced digestive fire, and overall weakness and fatigue, resulting in Shukrakshayajanya Hrudroga. In Sahasaja Hrudroga, increase of vata due to excessive adventure and exercise results in constipation and depletion of Mamsa Dhatu, resulting in Sahasaja Hrudroga. Shokaja and Dukhaja Hrudroga. Now, mental ailments such as grief and sorrow result in Hrudroga. While grief is held internally, sorrow is distant from the person. The impact of grief is even more pronounced than sorrow. While the person can forget sorrow, the wounds of grief are more difficult to heal. Therefore, the vitiated vata due to grief takes more time to return to its own space. Next is Buddhija and Chintaja. Now, there's shloka here, Rasavahini Dushyanti Chintyanam Cha Ati Chintanat. Chinta means thinking, Chintan corresponds to contemplation. An excess of Chinta and Chintan impacts the gati of the mind and therefore impairs the function and sensory functions of the sensory and knowledge functions of the buddhindriyas, resulting in hetus originating from prajna paradha, causing Hrudroga. In today's stressful work environment, we see a negative impact of the brain function and mind, which deteriorates the body's balance, leading to Hrudroga. During Udara Parikshan, one will observe a tim-tim nada on the liver, percush, along with other symptoms of fatigue, weakness, and neuralgia and asthenia. Now let's finally look at what are the treatment options that we can look at. Now, when treating the heart diseases from an Ayurvedic perspective, it is important to consider the hetus, causative factors, the doshas involved, the doshas impacted, the samprapti and sana samshaya relocation, the age, prakriti of the patient, etc., along with the Chikitsa Sutra. Now, treating Vataja Hrudroga, the Sukshma and subtle, the Sukshma and Slakshna gunas of the Akasha Mahabhuta deteriorate due to imbalance of doshas in the Pakvasha. To treat this condition, one will require to use the oil which has Sukshma guna and which will penetrate the Sukshma Shrotrasas and reduce the impact of the doshas therein. As the intestines also lose their elasticity, adding Amla Rasa to this tela will also help clean the intestines and restore the elasticity. Additionally, the tela which will also reduce the dryness and roughness in the intestine. Considering the Sukshmas, Vishada, Gunas and Tikta and Kashaya Rasas common to Vayu and Taila, the use of black sesame oil is very effective, is the most effective, I would say. And it has also Ushna, Tikshna, Sara and Guru Gunas. The Sukshma Guna has an affinity to Srotases, then therefore tail helps removing the Avarana and the Srotases. The Ushna Guna helps in Pachana, excess Prithvi and Mahabhuta, and in restoring the Avakash and the Srotas. The Malas of waste are moved due to a Saraguna. Similarly, Ushna, Tikshna and Sukshma Gunas reduces the excessive increase in liquidity in the Mutrava Srotas and helps in reducing the frequency in urination. Now, to re-establish the elasticity in the distended intestines and normalize the Vayu's Gati, we can use Amla Rasa. This can be achieved by using old tamarind soaked in water, some sendav salt and a cup of Arachi oil, 2 cups of drinking water. You can simmer all of these contents into a mixed aluminum and brass vessel. What remains will be, once the water evaporates, what remains is the Siddha Anuloman Tela, which can be administered to the patient 1 or 2 spoons before each morsel of his patient's meal. Now, this remedy treats the root cause of Vataja Hrudroga, which is Malavasthamba, and normalizes the Gati of Apana, Samana, and Vyanu, restoring Vatana. Now, Pittaja Hrudroga, the use of Go-Ghruta is beneficial. Snehanamuttam Shitam Vayasa Sthapanam Paranam. Pittaja Hrudroga need to consider the amount of ghee. You require considerable amount of ghee. Considering the gunas of Teja Mahabhuta, one can visualize the Snigdha and Ruksha Agnis by differentiating the quality of Agni before and adding ghee. Therefore, it is useful to think Snigdha and Ruksha Agni. In nature, you can make out the difference when you compare the fire from dry wood and the fire which is lit by ghee as a fuel. So it is important to understand when Pitta increases, just giving patient ghee won't help much. So for treating Ruksha Agni, one must use Siddha Ghrutas using herbs having Snigdha gunas to lower the Pitta. Kaphaja Hrudroga, the best medicine for Kapha is Madhu. Using herbs having qualities opposite to Kapha can be used with honey as an Anupana. Sanipatika Hrudroga, the treatment approach is based on a dosha that is prominent. Appropriate treatment can be given. Now, Ekantik Amla Sevana Janya Hrudroga. This type of Hrudroga, the best treatment is Nidana Parivarjana, right? So this means that the treatment should focus on stopping the intake of Amla Rasa completely and removing the impact of consumption of Amla Rasa from the body. For example, if you add salt to takra, you reduce the amlatva of the takra. Making use of this principle, the increase in Amla Guna and resultant enlargement of spleen can be treated with Vidangadi Kshar, is mentioned in Charaka Samhita, Charaka Chikitsa, Lihodara Chikitsa. Here we can use the sutra Ksharohi Yati Madhuryam Shigram Samhita of the Amlakshara Siddhanta from Panchabhautik Chikitsa. Krimija Hrudroga, root cause of krimi is ajirana or indigestion. Unless the krimis are removed from the body, Hrudroga will not reduce. Therefore, Bhumishodhana is the main chikitsa. This involves removing kleda and stopping the production of kleda. Involves removing the kleda and stopping the production of kleda. Chaturthokyo, combination of Kiratikta, Guduchi, Shweta Chandana, Sunti administered with honey is highly beneficial. Coming on to Shukrakshaya and Hrudroga, Chinchalavan is best for Baddha Kushta. Treating impactors Saptadhatus. Makaradhvaj is a Rasauchadi or choice for Shukradhatu, for depletion of Shukradhatu. Considering the Karyakara and Bhava, you can also use Safed Muesli and Neshtimadu Churna. To strengthen the intestine, one could use Pravada and Mandur Bhasma. In case one finds swelling of the Shotha or swelling of Shotha in the urinary system, Gokshuradi Gugulu will help. If the above treatment, the Hrudroga doesn't improve, you can use Swarna Bhasma. Swarna or gold has Gunadharma or Prithvi, Apa and Teja Mahabhuta. Also, since Swarna is Guru and Kashaya, it plays a major role in strengthening the heart muscles. Alternatively, if cost is of concern, Saumya Poti, Pravad Bhasma and Vanga Bhasma will help. Avrodhajanna Hrudroga. Now, in such presentations, you have to consider the impact of Hrudroga on the liver, spleen, urinary system and treat them accordingly. So, just talked about that earlier. So, use of liver, you can use Tamra Bhasma. Spleen is affected, you can use Virangati Shad. The inflammation in the bladder, you can use Gokshuradi. Gokshuradi is this thing a choice. In case of excessive dryness, Phalatrikadi Kada is better. Now, in case of excessive dryness, Phalatrikadi, when the treatment protocol, the patient's Agnisanta is re-established. So with this treatment protocol, what happens is we establish the Agnisamstha, consider the impact of Agnisamstha and the treatment accordingly. Pravad Mandur Bhasna is a Rasayana. Thereafter, the impact of Rasa Rakta Dhatus and intestinal flora can be strengthened with Pravad and Mandur Bhasma as a Rasayana. Manasika Hrudroga. Now, treating Hrudroga due to Manasika Vikruti such as grief and sorrow, overthinking, anxiety, excessive use of brain is tricky, and because the Vyadhi comes to light only when they are deep rooted, and therefore it is difficult to treat, which becomes Krucha Sadhya. One must first assess the impact of emotions on mental stress on the Indriyas, mind, Manas, and Buddhi. Once the causative factors of these Vyadhis are removed, the patient will experience significant relief. Excessive stress on the intellect can also present symptoms of stress due to studies, staying awake, stressful job. A Vaidya must consider the impact of the stress on the Sharira, Indriyas, organs, Manas, and Buddhi. Now, to treat disorders due to stress, Jatamausi Fant or Tapaswini will help. Now, to remove the impact of Rudra on the rest of the body, you can use Vasanta Kalpas, such as Vasanta Kusumakar Rasa gives good results. For treating constipation, obviously, Chinchalavan tail is the best. Now, in Sahasaja Hrudroga, here again, for constipation, you can use Chinchalavan tail, as unless the constipation is removed, other medicine will not work. Now, treat the impact of Mausada to Shiddha, Shatavari Gruta is useful. Similarly, to the depletion of Rasa Raktadi Dhatus, Pravara and Mandu Bhasma can be administered. To treat the impact on lungs and breathing, Mrugashanga Bhasma can be used, which will give good results. With this, I come to my 20, 25, 30 minutes of allocated time, and just want to further acknowledge the fact that this is a knowledge base that I have gathered from my revered guru, Vaidyaraj Datar Shastri, in his book titled Ayurvedantargat Hrudrog, and the original summary of which was presented by Dr. Ashok Wali, the chairman and president of the Datar, Panchabhautik Chikitsa and Anusandhan Sangli. If you have any questions, I'm happy to answer. And my contact details are here. Anyone has any questions? Thank you.